Great. Okay, everybody, thank you so much for your patience. We're 4 minutes into our hour, so we're going to go ahead and get started. Hopefully we don't have any more technical difficulties. But with that, if we do, this is my little housekeeping. I will send out the slides regardless. If we run into more difficulties, I'll just circle back with you all via email and send out the presentation. We record it at a different time. This is being recorded, so you will get the recording. You will get a PDF of the slides, and then you will also get just some links in an email after this. A couple days, I'll probably send it out here. An evaluation to fill out, thanking you for your time and everything like that. And so with that, we're going to go ahead and get started because we have a lot to cover. But first, I really want to say thank you to our wonderful partners at the Kansas Department of Health and Environment and the Kansas Maternal and Child Health. It's because of our partnership with this organization that we are able to bring this material to you today. The materials, the print materials, all for free for everybody in Kansas. And so we're super thankful for this partnership. We've been with them for a couple years. I love doing these webinars. I love sharing this information. And with that, we'll go ahead and get started. I'm going to turn off my video because I have some videos to share, and I don't want that to mess with broadband or anything. All right. So you all are super lucky because you have two presenters today. Myself, I am the program director with Healthy Birthday Inc. I've been with the organization for about 2 years. Prior to that, I worked for Iowa Department of Public Health in tobacco prevention and control. And I am very passionate about maternal child health. I am very passionate about prevention and education, and I have 3 kiddos of my own. I have used the app with my last one, who was in 2018, and the end of my second one, which was in 2015. And so I'm excited to be here today for the organization. I work on the grants for the organization, and then I also work with all of our state partners, make sure grant deliverables, state deliverables are being met, and then I get to work with a very close-knit team, and one of which is my colleague Stephanie here today. Go ahead, Stephanie.
Well, good morning, everyone. If you could go to the next slide for me, please, Megan.
Yeah.
I am Stephanie Moody, the new Health Equity Coordinator. I've been here for about 6 weeks, but my work with Count the Kicks began back in 2018. I found out about Count the Kicks, and the way that I found out is I was a part of an organization called the Pastors Ministers Alliance, and we worked together so that we could address the issues within the African American community when it comes to equities within the stillbirth rates between African Americans and our white peers. We were working together with a group of community leaders who decided to do something about it, and you'll learn more about it as Megan and I share the different slides that are up and coming. My passion was driven by the experience our family endured in 1991 when my sister Angie lost her daughter Jasmine to stillbirth. Now, she would typically labor a few hours and then give birth, but this time she labored for a few days and she knew something was wrong. She explained to her doctor that something felt off because this was different than any labor she'd ever experienced in the past. But she had no data to prove back then that Jasmine was actually in distress. And I believe that if there was a Count the Kicks app back then, Angie would have been able to share more than just a feeling that something was wrong. She would have had some data to prove it. Well, while we were working on the Count the Kicks campaign, my son and daughter-in-law became pregnant, and I asked my daughter-in-law, Courtney, if she had heard about the Count the Kicks app. And on her due date, Court thought she was in labor, but she noticed that Luna, who you see in the picture here right beside me, she wasn't moving as much. And so she contacted her doctor, who told her to drink some water, lay on her left side, and to time the contractions. Being a first-time mom, it's not abnormal to feel a little anxious about giving birth, as you all know. But Court decided to go into the emergency room because Luna was not moving like she normally was. And it was because of her use of the app, my daughter-in-law was able to provide the doctor with the data to show that Luna was not moving like normal. And upon examination and monitoring, they realized that there were actually 2 health issues that would have prevented Luna from having a healthy birthday. And since then, I've continued sharing my story, empowering women by teaching them importance of counting their baby's movements, as well as tracking them through the use of our app. Luna is now 2 years old, as you can see her in the third picture there. And she is also now a big sister to her brother Ramare. And I am so excited about being here today and also being able to share with you from the perspective of my dream job, saving lives. All right, Megan, back to you.
Awesome. Thanks, Stephanie. And yes, we always love hearing Luna's story. She's such a cutie patootie. And with that wonderful story, I also want to start off sharing a video from Good Morning America. And I share this video for a couple of reasons. One, it does a really good job of showing you exactly what the app is and how it works and how it can help save lives. Two, it's another feel-good story, just like Luna, a baby safe story. And three, it really goes to show you that mom-to-mom storytelling. That story that Stephanie just shared, this story that you're going to watch, this is what really gets to expectant parents. This really helps them remember. It's really important. And so anytime we have a story like this, we want to share it. And we have these baby safe stories. We have these videos you can share with your expectant parents. They're great to share in childbirth educator classes or just in your waiting room or things like that. And so I'm going to share this Good Morning America video. Let me know if you can't hear it, Stephanie.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the third trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So like I said, that mom-to-mom storytelling, like you heard just now, the app had increased users, and we've been very high since then, not as high as when Ruby aired, but I think it's just really important to share, and plus it's a feel-good story. And so before we get too much further, I know a lot of you are medical professionals and in the health world, but I want to make sure we're all on the same page. And so what we're talking about today is obviously stillbirth, and stillbirth is the loss of a baby after 20 weeks of pregnancy. It's further classified as either early, late, or term. And on average, there are 23,500 babies born still every year in the United States. A miscarriage is usually defined as the loss of a baby before the 20th week of pregnancy. And then there's infant mortality. Infant mortality is the death of an infant before his or her first birthday. On average, around 22,000 infants die every year in the US. And I share this not to underscore infant mortality by any means, because that is also a tragic, tragic event in somebody's life. But I really want to share the importance to see that stillbirth is just as prevalent as infant mortality. In fact, it's slightly higher. Yet we rarely talk about it, right? We rarely talk about stillbirth, let alone stillbirth prevention with people and media out there, and this is why you're here today. This is why we do what we do. We want to make you comfortable talking about stillbirth prevention so that you can be comfortable talking about it with your expectant parents, and they can learn how to track their baby's movements and how to speak up if they notice a change, so we can change that narrative. We talk so much about things like the Back to Sleep campaign, running a fan in baby's room, not smoking around baby. And we want Count the Kicks stillbirth prevention to be just as talked about as those other prevention methods. And that's why you're here today. That's why we're so excited to be talking to you today. We don't go into the causes. Obviously, we're talking about prevention, but if you're really interested, there is a research study here, but shows some of the most common to least common causes of stillbirth, things like pregnancy and labor complications, problems with the placenta, birth defects, infection, problems with the umbilical cord, and then medical complications in the mother. And if we're looking at the data again, we know that nationally, 1 in 169 pregnancies ends in stillbirth. The racial disparities are huge. Black women, it's 1 in 96. Black women are 2 times, sometimes 3 times in some states, more likely to experience a stillbirth over their white counterpart, peer, or neighbor. Hispanic, Latinx women, it's 1 in 199. Indigenous women, 1 in 138. White women, 1 in 204. Asian Pacific Islanders, 1 in 233. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. If we look at the Kansas data a little bit closer, we have 2019. The 2019 rate for Kansas is 5.4 per 1,000 deliveries, so 5.4 fetal deaths. If we look at the race information for 2015 to 2019, non-Hispanic Black mothers, it's 11.3. So you can see it's 2 times more, double than the state in 2019. Hispanic, 6.7, and then non-Hispanic white is 4.8. And the reason I tell you this is because we want to get to a point in Kansas of what we've gotten to in Iowa. And in Iowa, we have seen about a 32% reduction in the number of stillbirth since the inception of this campaign. So 2008 to 2018, we saw the 32% reduction. And we've stayed pretty low since then. Our 2020 preliminary Iowa stillbirth rate is 4.0. So like I said, this campaign was created in 2008. If you look closely on your screen, that little teal dot there, you can see that's been the highest on record on Iowa's history in this time frame here that shows stillbirth. And then you can see the red line is the national rate, and then the trend is that dotted line. So you can see we have been in a downward trend. In the first 5 years of the campaign, we saw a 39% reduction in the number of stillbirths among African-American women in Iowa. And so you can see we're on the right track. We do have some outliers on there. That's why we really look at stillbirth data as averages or after several years to get that trend. And this is what we want to bring to Kansas, right? This is what we want to show and save, bring this 32% reduction to Kansas. And this is why we're talking to you today. And now I'll let Stephanie go ahead and talk a little bit more about those racial disparities that I just recently talked about. Go ahead, Stephanie.
Perfect. Thank you, Megan. So as mentioned on the previous slides, there is definitely a large divide when it comes to those who are more likely to experience stillbirth. And I wanted to take a moment to share what research has shown to be some contributing factors to this. So I want you to note that Healthy Birthday Incorporated has reviewed research articles, and these points come from various articles that we would be happy to share with you if you are interested. So you may wonder why there are such large disparities for stillbirth. Research does show that there are a lot of contributing factors to the racial health disparities in stillbirth. Researchers point to the following causes for the disparities: systemic racism, when policies, practices, representations, and norms work together to perpetuate racial inequity. Examples include higher infant mortality rates, less school funding, harsher punishment for crimes, less income. Also, toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society and all that it comes with, has led to real and pervasive health issues for Black women. Epigenetics, the physiological variations that are caused by external or even environmental factors that switch genes off and on, and it affects how the cells read the genes instead of being caused by changes in the DNA sequence. predisposition of certain conditions that can lead to stillbirth, like gestational diabetes, preeclampsia, or high blood pressure, which all are linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions. There are poor access to healthcare, socioeconomic barriers. Research also shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school educated white woman. Can you go ahead to the next slide, please? All right, so what is Count the Kicks doing to reduce the racial disparities? Well, what we are actually doing is, one of the things we've done is we've hired me. So I'm the health equity coordinator on staff. I am always looking for ways and ways to partner with other organizations to ensure that we are focusing with that equitable lens and reaching out to the other people who are struggling with the stillbirth rates, that have the higher stillbirth rates. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We are an inclusive organization with 100% board and staff training on an anti-oppression and structural racism. Also improve programming based on the lived experiences of women of color. Working within marginalized communities, we make sure that we reach out to those communities and share the educational information, our app, and connect with the different community, the community organizations that they would go into. We have also translated our app into 12 different languages. We ensure that there's culturally appropriate educational material. There's also videos and printed educational materials, and even a frequently asked questions page that's in multiple languages. Now on our next slide, we're gonna see a video of Brianne Ward, who's an African-American licensed mental health counselor. She's also an advocate for Count the Kicks here in Des Moines. And through various partners, we're able to continue our work to be more inclusive and address the racial disparities that exist. Go ahead and play the video for us, please, Megan.
Did you know Black women are 2 times more likely to lose their baby in the final weeks of pregnancy than their white neighbor, colleague, or friend? It's true. For Black women, 1 out of every 96 pregnancies will end in stillbirth. As a mom and mental health counselor, these statistics are beyond troubling. They're unacceptable. At Count the Kicks, we've developed a free, evidence-based tool to help you monitor your baby's well-being in the 3rd trimester of pregnancy. The Count the Kicks app is saving lives. Here's why it matters. Studies show babies move less when they aren't doing well. Just like when adults feel sick, we want to lay in the bed or on the couch. It's the same with babies. If they are struggling, their movement changes. A decrease or rapid increase in movement is the earliest and sometimes only indication that there might be an issue with your pregnancy. The Count the Kicks app is a powerful stillbirth prevention resource, allowing moms to have a daily kick counting session to get to know what's normal for their baby. You can even share your kick counting information with your partner or friend. If you notice a change in what's normal for your baby, we encourage you to speak up to your provider. Don't wait. Hospitals are open 24/7, ready to serve you. We want you to have the joyous birth experience you deserve. Download the free Count the Kicks app today.
Great. Thanks so much, Stephanie. Before we get into the kind of the meat of the implementation of how Count the Kicks works in the app, I do want to just stress a couple things with you. This is a research and evidence-based campaign, and this is the research study that started it all that you see on your screen. And so, like I briefly mentioned earlier, we were created and founded by 5 Central Iowa women. These Central Iowa women all experienced stillbirth or infant loss in the early 2000s. They didn't know each other at the time. They got connected through pastors and friends. And as they got together and started grieving together, they started talking. And what they started to realize was that stillbirth is a lot more common than people think. Here they were, 5 women all sitting around a table thinking, you know, we were told this, you know, this isn't common, this doesn't happen often, but here they were just sitting there. And so what they did is they were at a stillbirth prevention conference, they were at a public health conference, and they heard these researchers out of Norway talk about this public health study that had been done that showed within this cohort of pregnant women, when they were educated on the importance of tracking fetal movement and to understand what's normal for their baby, the stillbirth rate decreased around 29-30% within this cohort. And so the women, the founders that heard this, thought to themselves, that's amazing, 30% reduction in stillbirths just by learning and educating about what's normal for your baby. And so they thought to themselves, we can do this. We can create this here in Iowa. Great things start in Iowa. If we could just save one baby, it'll be worth it. And so that's exactly what they did. They came back to Iowa. They worked with Iowa Department of Public Health and a marketing company here to create Count the Kicks, the stillbirth prevention education campaign that you know and see today. This is a quote taken from that research study that started it all. It says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement patterns starting at 28 weeks and to speak up if they notice a change. And so Dr. Ruth Fritz, she's also on our medical advisory board now. You can see her name circled. She was one of the lead researchers on this study. But it's not just this research study. There are tons of research and evidence out there that highlight the importance of tracking fetal movement during pregnancy. Some other thoughts you might have, some misconceptions. You might be thinking, no, this is just going to increase anxiety in pregnant women, but it doesn't. And research has shown that, and our app survey results have shown that. So here's a quote. It says, one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. Usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. And you can see that last bullet on our on the screen here. That's what we find too with our finished pregnancy survey. We have this pregnancy survey on our app. It's completely voluntary, but when we analyze some of the data, a year's worth of data, we found that 78% of women reported the app made them feel less anxious. And just anecdotally, when we talk to women, they say, this gives me real numbers, quantifiable numbers that I know when to speak up. I know when to go to my provider and say, look, this is not my baby's normal. We're also in the middle of a research project with Des Moines University and the Harkin Institute, looking at mobile health technology and hypothesizing how it works with stillbirth and stillbirth prevention. And some of the preliminary results, we can't share everything because it's still being in the manuscripts phase, but preliminary results show a reduced rate in stillbirth for the pregnancy in which they use the app compared to earlier pregnancies. Maybe some other misconceptions you've heard or think about are the increase of C-sections and interventions. But in fact, you know, here's another long quote you can read on your screen. That just isn't the case. In Iowa, we haven't seen the case in C-section rates because of this or anything like that. And so if anything, it can help prevent those later on. Some other benefits that you might not think of: reduction of preterm birth rate, fetal growth restrictions identified earlier. We know women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. And this quote says, you know, due to the low cost and potential benefit, it's recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So again, I just want to really highlight that this is an evidence research-backed campaign. We have a whole page dedicated to the research. And so you're more than welcome to go there. Here's some additional articles that I always like to highlight. But again, just wanted to stress the importance of that this is an evidence-based research-backed campaign. And now what you've all been waiting for probably, I would love to invite Stephanie back on to talk about how to implement Count the Kicks.
All right, so now that we've learned about why kick counting is important, let's go ahead and look at use of the app and what implementation looks like for you as a provider. So as Megan stated, Count the Kicks is a stillbirth prevention public health campaign, and it's based on research and evidence. We've looked at the evidence to ensure that we are giving you something that is actually going to help. We know that it's helped because we've seen the reduction in Iowa of over 30%. It's mom focused. And as you can see, the materials are very bright, they're colorful and empowering, which is exactly what the founders wanted. They wanted something that was going to catch the eye of the user, and it would make them feel empowered to be able to count the movements and be able to share that information with their doctors and even with their families. It educates women on the importance of tracking fetal movement. We have both a mobile app and paper charts. We've even created bracelets for those who do not have access to a smartphone, or maybe they don't have the internet. So every time they feel a movement, they simply either move the watch piece over one time for each movement that they feel, and they're able to track how long it takes for their baby to get to 10 movements. This data empowers moms to speak up to the providers if there's a concern. Again, with My Luna, Courtney was able to share that information. Next slide, please. So let's talk about our app. You can go right now and download the app if you'd like. This is one of the only times that you'll ever hear me say to multitask in the midst of a meeting, so that you yourself can see how easy it is to use and also feel comfortable sharing it with expectant parents that you come into contact with. Our free app is evidence-based and available in 12 languages. It's in Amharic, Arabic, Chinese, English, French, Haitian Creole, Hindi, Marshallese, Russian, Spanish, Swahili, and Vietnamese. It's also available in Apple and Android. So you don't have to worry about what type of product that you use or what type of phone that you use. Users can restart their session if they get interrupted. Maybe they have to take their 2-year-old or 3-year-old to the restroom because they're potty training, or somebody comes to the door while they're kick counting. Whatever the reason, they have the ability to start over and track the 10 movements. If they accidentally track a movement twice, they can simply hit the undo button and delete the kick that they counted. We're all busy. So if you're anything like me, pregnancy brain was a real thing. And the app has the capability to set a daily reminder so that you'll be reminded to count kicks at the same time each day. You can review your kick counting history. And if you see or notice a significant change, you'll see the spike in your kick counting history. As you can see over on the right of the screen, that is the history. You can download that history so that you can share it with your provider. You can share it with family and friends via text or email. You also have the capability to count for twins. You can track future pregnancies on the same profile, so you don't have to re-register each and every time you get pregnant. And then you can also manage it on multiple devices to one registered account. So I can be on my iPad as well as my iPhone and have the same account. It'll also be available very soon. Within the next few weeks, we're hoping to be able to release this, but it'll be available on the Apple smartwatches. If you could go ahead to the next slide. All right, so to get started, you want to sit with your feet up or lie on your side. And when you register on the app, it's going to ask you if you would like to count for single babies or for twins. And when you choose twins, the kick counting session will include 2 different buttons. One button counts the movements of baby A, and one button counts the movements for baby B. You count each of your baby's movements as one kick and tap the app button. They look like little baby feet, so it's going to be like a little yellow baby foot. And until you reach 10 movements for your baby, you'll just keep tapping it each time. You track everything except for hiccups, because hiccups are involuntary. And after a few days, you'll start to see a pattern for your baby, and you're going to have the statistical data to show how long it takes for your baby or babies to get to 10 movements. Now, most of the time it'll take less than a half hour for you to get to 10 movements, but it could take as long as 2 full hours. Doctors believe that moms can differentiate between baby A and baby B if it's twins. But if you have questions on this, you can always feel free to, refer to your doctor or ask. So you want to save your kick counting session in the app to see your baby's movement history. Knowing what's normal for your movement, knowing what is a normal movement pattern for your baby is key. When normal changes, this could be a sign of potential problems and an indication to call your provider. The app user's kick counting history can be real useful for visits with your provider, and the app will record the amount of time that it takes for your baby to get to 10 movements, or you can log your times. into a downloadable kick counting chart. Now, someone might ask, what's considered a change? Because we don't want a whole bunch of influx in appointments out of fear. The app starts showing the average time that it takes to get to 10 kicks right away. As soon as you start using it, you're able to see it. So the user will notice and see their baby's pattern or the trend. Now, if mom starts noticing that it takes baby close to an hour, when it usually takes 15 minutes, it's time to call. Megan, can you go to the next slide for me, please?
Yeah, I'm actually just going to do a quick demo too for people to see. So if you haven't multitasked, like Stephanie said, and downloaded the app yet, you can see, just have a quick video here. There's this big red button that says start counting. And I just want to show you just how user-friendly it is. So there's this how it works. So this is the big footprint that Stephanie was talking about. Every time mom feels movement, she's going to hit that little footprint and the timer starts automatically. And so every time we're going to hit that, I'm going to go out of it. There's that how it works at the bottom of your screen. This is called like a carousel. These are a couple slides that everybody sees when they first log on and register for the first time. It's basically the directions, but you can access these at any time. So if mom's like, oh shoot, I forgot, I can't remember how to do this. Am I supposed to do it daily? They can access this. And so I just wanted to show you that you can go out of your kick session and come back to it and it picks right up. So maybe you were reading that while you were waiting for baby to move or something like that. And so you can also go out, check something else out, and it's gonna say, do you wanna continue your kick session? Like Stephanie said, maybe they had to run out and, you know, take toddler to the potty or something like that. If it's just a couple seconds or minutes where it's not really gonna change your average that much, then that would be fine. Now, if mom's like, oh, I completely forgot and it was running for like, you know, 2 hours, 3 hours after, then she should just start a new session. And so you can see this says at the top, it says total time. That session took 1 minute and 2 seconds. The average time, obviously we don't have that yet. We've only done one, but it has the date at the bottom and then it has like the full history you can share, or you can go ahead and click finish session, which I just did. And so if we're going to do it again, we're going to start counting because I'm just going to show you the graph really quick of how it works. So that's why I'm going super fast. So you can see mom's already starting to get that great user-friendly, that visual that really shows what baby's movement pattern has been. And so that will start to build and start to show her after a couple sessions. Once she's registered, it shows about 5 or 6 sessions. And this is where she can look at the data, she can look at their kick session history, she can download it and send it to her provider if she likes. I know we use my chart personally, so I could email it to them, I could download it and take a screenshot and upload as a picture. There's just a lot of useful ways that they can have this. And like Stephanie said, you have that statistical data to show that. And so there's lots of other things. There's some of our baby safe stories on there. There's an FAQ on there. This is me. I went and started counting in Spanish. You can see it's very similar, like it's the exact same, it's just in Spanish. So it's very user-friendly and easy to understand no matter what language. Here's the reminders. We really recommend setting those reminders because we know even in a pandemic, we have been busy. We've been hybrid and online school and working from home and working in the office and things like that. And so setting those reminders, so making sure you talk to your expectant parents about setting daily reminders is really important. And then I just want to show you one more quick thing. I'm going to create a new pregnancy profile. So this is where I would create if I'm having a singleton or twins. Right now I'm counting for twins. So I like the name Georgia. So I just said Georgia baby 1 and Georgia baby 2 to count for twins. And so what research says that moms can still, I've never been pregnant with twins, but moms can still feel pretty well which baby's which and which movement's which. And so from talking to other expectant parents who have had twins, there's a couple of ways you could do this. You could do it like Stephanie said on the same count session where I'm going to show you here in a minute. I'm going to go back and count. So you can see you have both babies up there. The one that I'm feeling is highlighted in that teal color. So I know I just felt baby 2 move. So I'm going to start feeling those movements and start hitting that button and the timer's gonna start. You can do it like this, or moms can go in and just do one at a time and focus on baby 1 at a time or baby 2, whatever they name it. They can name them whatever they want. And so I just wanted to show you, but you'll get the chart for each of them. You'll get all the notes and everything like that. And so I just wanted to make sure to highlight that. But like I said, and like Stephanie said, go ahead and make sure that you are using it and comfortable with it, so you can pull it out with your patients and say, look how easy this is. Now, there's a new feature as well that we're so excited about. We will be launching this in a couple weeks, but I really wanted to share it today with you all since we're already talking about it. So be on the lookout for when this comes out. Because research shows expectant parents should also be paying attention to the strength of their baby's movements. At the end of each kick session, like you just saw, what will happen when this app update comes out is they will also be asked the strength of that session, and they can fill out those little feet, depending on how strong baby's movement was. And it's really important to pay attention to the strength of the baby's movements. If you think back to that Good Morning America video where the mom said, her movements were just softer and weaker. It just didn't feel like normal. So that could be another sign baby's in distress and should be checked out. So we've added this function along with the help from researchers and research articles, again, because that's very important, that evidence. And so this is what moms will be able to count as well, to include in their sessions to share with their providers. They also can add additional notes. So let's say they want to say something like, I got interrupted during this kick session, or had to stop to take my 2-year-old to the potty, or something like that. That will also be an option. So again, this is not out on the app yet, but I really wanted to stress it with you today because it is an important feature and it's quite a change in addition to our current. Everything else will stay the same. This is just adding to it. And then like Stephanie mentioned, we have the watch coming out soon. So you'll be able to count and do the strength all on the watch. So let's say mom's upstairs in bed resting or something, or napping, and she's like, oh, I got the reminder on my watch, I need to count, but my phone is all the way downstairs. She can just do it on her watch, and it's just compatible now. So we're super excited about that. So now that you know more about the app and you know more about Count the Kicks and how we were founded in the research, how do you talk about this? How do you talk about stillbirth with expectant parents, expectant women? Maybe you're thinking you don't want to scare moms, but we know, pregnancy is full of risks that we talk to moms about. Stillbirth is another risk that moms deserve to be educated about. Stillbirth just happens. There's nothing we can do. There can be warning signs. Reduced fetal movement is one of the early signs that baby's in distress. So if moms know what to look for, then they can speak up in time. Her baby is always active. It's not a concern. You might get this one a lot from expectant parents themselves, like, oh, I don't need to do that. Baby's always moving. I never get a break. But it's really important to stress that babies are active until they aren't. Cord and placental accidents can be sudden, and moms need to know what's normal so they can notice a change. Plus, it takes the guesswork out of knowing. So let's say your normally active baby is 7 minutes or less and you get those movements in. And then one day you're counting and you're like, it's more like 20 minutes today. Is it normally 20 minutes or is it 7 minutes? It takes that guesswork out of knowing and remembering that. She's almost at her due date. The risk of stillbirth actually increases as mom approaches or exceeds her due date. And so some other misconceptions that you might hear, babies move less the closer to their due date. But they don't move less. They actually move differently. You may feel less sharp kicking and more rolling. However, if you're monitoring the baby's movements at the same time, it should take about the same amount of time to feel those movements. Here's that active one again. Active babies can also experience distress, sometimes quickly and without other warning signs. Again, it takes the guesswork out of knowing that. Here's a big one, especially with COVID and when we had telehealth appointments so much. You can hear baby's heartbeat, or I can hear baby's heartbeat on a Doppler device, so I don't need to worry about movement. A change of baby's heartbeat is one of the last things to occur when a baby's in distress, whereas decreased movement is an early sign. I know there's apps you can download and things like that. So unless they're medically trained, we really don't want moms to use Doppler devices. We also want medical professionals to do additional tests after the Doppler, right? They should be doing those NSDs. They should be following that protocol in place of when somebody comes in with reduced fetal movement. Babies just getting ready for birth and running out of room. This is something that you might hear a lot, especially if somebody lives with grandparents and things like that. And then that multi-generational. So baby should continue to move up to and during birth. And then mom should get 10 kicks in 2 hours. this is a common misconception and outdated information. What research now states is that moms should be focusing on fetal movement in general and understanding their baby's pattern. There is a research study on our website about this, and basically what it says is, when we as humans, when we focus so much on that time, when we focus on that 2 hours, that's what we focus on. So let's say I'm counting and I know my baby's normal is usually around 15 minutes, but one day I'm counting and I get it in an hour and 45 minutes. And I think to myself, that's totally okay because I got it within 2 hours and my doctor said 2 hours is fine. And so but that's not okay because she normally gets it around 15 minutes. So we want to kind of remove that thinking where we just want to make sure moms understand to realize what's normal for their baby and that pregnancy, and to remind them every baby and every pregnancy is different. I have had 3 children. My 2 boys, they got 10 movements within 10 minutes or less. But my daughter, she would take 30, 40, 45 minutes, 50 minutes. I remember calling, I remember going into triage to get things checked out, until I understood that was just her normal. Her normal was, super laid back and chill in utero. And I thought I'd have a super chill baby, but she wasn't, and she's a feisty little thing. So I love her, but so every pregnancy, every baby is different. And then only high risk expectant women should do this. No, we want all women to do this. We don't only do the glucose test for high risk women. A lot of women who do have stillbirths had no other risk factors. I cannot tell you how many women we speak to that have had stillbirths that said, I had no risk factors. I had nothing. I've had 2 previous live births perfectly healthy, and now I had a stillbirth. Why didn't anybody tell me about this? Why have I not heard about this? Why didn't I know? And so that's why we do this. We want to turn those why didn't I knows into that I'm so glad I knew. I'm so glad I was told about this. I'm so glad somebody took the time to talk to me about this. And so when do you talk about this? 26 weeks if they're high risk, 28 weeks otherwise. You can do it in childbirth ed classes. Like I said, we have those resources on our websites and lesson plans. Asking them questions. Do you know about the importance of tracking your baby's movements? Let's talk about how to track your baby's movements. Again, sharing how movements are jabs, rolls, pushes, anything but hiccups, like Stephanie said, because those are involuntary. And then of course, sharing the app, right? Pull out your phone, pull out the app card, pull out the brochure, say, while you're waiting for your glucose test, while you're waiting for that blood test and to come back, download the app, look at this brochure, and then we'll talk about it when you come back for your appointment. So there are lots of ways you can easily integrate this into your protocol. Stressing the importance of knowing their baby's normal and speaking up if there's a change. I can't stress that enough. You'll hear us say it time and time again. Understanding their baby's normal and speaking up. It's all about empowerment. Does mom know who to call, what number to call if it's 2 a.m.? And that goes for anything, whether it's fetal movement, bleeding, cramping. Is there a number? There's an after hours number. Is there a nurse on call? Make sure she knows, and make sure she knows that you will not be bothered, or the healthcare professional, if you're home visitors or anything like that, working with expectant parents, that is what providers are there for. They are there to answer your calls and to answer your questions. So sending a brochure home with mom, or the app card, or both. Sharing with mom that research shows evening is usually the best time to count baby's movements. I wouldn't get too hung up on that. We know people work 3rd shifts, but that's just what research says. So we really want to stress that doing it around the same time every day is important. And then think of those motivational interviewing tactics. So tell me about your baby's movements. How is tracking your baby's movements going? Can you show me your graph? What questions do you have? If you're not their provider, make sure to encourage them to talk about it with their provider. Say, hey, has your provider talked to you about this? You should bring this up at your next appointment. Talking to moms who have had stillbirth previously about fetal movement, again, you're going to follow the same protocol. Since women who have had a stillbirth are more likely to experience another stillbirth, you want to start talking about tracking baby's movements around 26 weeks versus 28 weeks. Make sure that you do talk about the previous stillbirth and acknowledge her child that was born still. Ask about the name, the gender, especially if you weren't her previous doctor. Stay away from medical terms like fetal demise. Be empathetic. Ask if anybody has talked to her about the importance of tracking fetal movement. Like I said, a lot of moms who have had previous live births have said, this was never on our radar. Nobody ever talked about this. And that's why we're here today. This is what we want to change. And so again, this is super easy to implement into different settings, whether you're on today representing an OB clinic, a midwife, a doula, home visitor. What you really need to do is follow the exact same steps. You're going to become familiar with Count the Kicks materials in the app, which is this presentation today. You're going to go online after this presentation and you're going to order the materials. You're going to review our website and any sample materials that you think would be beneficial. You're going to ask us for additional webinars if you want your whole team to know, or you can share this recording. And then you're going to integrate. I am all about systems change. So if you can integrate this into your workflow, your plans, document it with your, your family care plans and things, knowing, okay, mom's 12 weeks pregnant, in X amount of months, I'm going to start talking about Count the Kicks and mark it on her form. So you have that reminder. Integrate into Epic. So there's a pop-up that comes up every time mom comes in after 28 weeks. So again, you want to stress to parents to trust their instinct if mom feels concerned or that something isn't right. Share that sleeping lying on their left side is best for them and baby, and then reviewing the common myths. But if they wake up on their back, of course, they just flip to their side. I get that question a lot. And I like the stressing to parents to trust their instinct a lot, because especially if you have people that live with multi-generational homes, what we don't want is we don't want mom to feel concerned or something like that, and then to have somebody close to her say, don't worry about it, you have an appointment tomorrow, or something like that. We don't want moms to be second guessed by anybody, and so to trust their instinct. And a lot of times that instinct is spot on, right? If mom feels like something's off, we hear that a lot from our baby saves. Just something felt off, my kicks weren't right, that wasn't normal, and I had to speak up, I had to go in. And so some next steps for you, obviously download the app, play around with it. It's very user-friendly, but become familiar with it. Make sure you share all of this information with the staff and then order the material. Other ways to integrate that I talked about, using a format check-in similar to this that we've created. This is super simple. When you check in, you can have mom fill out this form while she's waiting, or she's waiting in the patient room, have the nurse hand it to her. And then it just encourages the provider to talk about it, or the nurse to talk about it, because she's already filled out those questions you may have asked. Maybe she has other questions and she can fill it out that line. And then this is perforated. And so if you're really interested in this, if you work in a clinic setting, we're piloting this right now. I'd be happy to send you a couple to see how it works. But these are just some ideas that you can easily integrate. You can take this and I can help you with some wording to integrate. This is from Celebrate One, a partner of ours in Ohio. And what they did is they added this paragraph. You can see halfway through, it says, have you started prenatal care? And then have you downloaded the Count the Kicks app? Yes or no? And then we came up with some language that they could use to talk to expectant parents, because they don't see expectant parents continually. They see like the one person and then they move on. They're a nonprofit organization, but they do see and serve around 2,000 pregnant women a year. And so that touch point is key and super important. And any touch point that we can have, whether you're a home visitor, you're WIC, you're an OBGYN, you're a nurse, you can put the stuff in the waiting rooms, you can talk about it, the more the better. And so with that, I'm going to have Stephanie. I'm going to take a little breather. I'm going to let Stephanie talk about some of our awesome resources.
Thank you. I'm off mute this time. How about that?
Oh, great.
All right. So again, she spoke about the educational material. We have lots of resources for you, from promo posters that are in English, Spanish, and Haitian Creole, the how-to posters in English, Spanish, and Haitian Creole. We also have app card reminders, just in case they don't have the cell phone to be able to set the reminder. They can use the app card to remind them. And then also there are the brochures that we talked about that are bright, that are colorful and empowering. And then the awesome new thing that we have are magnets that you can actually hand out to those that you serve. Now, when you're ordering them, you're going to go to www.counttthekicks.org. And after you've added in all of the different items that you want at the end, it's going to ask you if you would like to add a bundle of magnets, which is, again, a nice way to remind parents to count each day in the third trimester. Go ahead to the next slide. We also have a CE training that is worth 1.5 continuing ed credits. And this is to educate healthcare professionals on how to talk with their patients about fetal monitoring, as well as the best practices that are surrounding it. So this, you can find it at www.dmu.edu. And when we send you the PowerPoint, you'll be able to pull the web address off of there as well. And then there's some other resources that we have, the Parent Academy and the Provider Academy, the kit counting charts, again, which are in English, Spanish, and Haitian Creole. All of those things can be pulled right from our website. And then there's also a tab that is on the COVID-19 response and ways to be able to implement this during this time. All right. We have our ambassadors that are in many states across the US, and these women are volunteers who are passionate advocates due to their own personal experiences. So for me, my personal experience was my daughter-in-law being able to utilize the app, and she was able to save our granddaughter. But some of the women who are part of our ambassador team, they actually did not get to save their baby in time. And so they want to turn their grief into action, just as our founders did, and make sure that no other family has to endure that pain if they can educate them and it is a preventable stillbirth. So they attend a variety of events, such as medical conferences and baby fairs. They give media interviews. They work to grow our partnerships with us. They also fundraise and do a whole lot of other things.
Great.
These are our Kansas ambassadors: Sapphire Lees, and I might be mispronouncing that, Indiana Cummings. Go ahead, Megan.
Yeah. Great. Thanks, Stephanie. And then I just wanted to highlight a couple of our baby saves. We have over 75 baby saves on our website, and we know there are more out there. We have Nala and Eva and Everett and Luna on here, and Eva is actually a Kansas baby save. And so I love, love, love this quote that I pulled from Yelly, Eva's mom. And she says, "I'm very grateful that Count the Kicks made me aware of the importance of paying close attention to babies' movements, and also that my provider took my concerns seriously and took action. I pray that my daughter stays healthy and continues to grow to become whoever her heart desires. I highly recommend the app to all expectant parents. Happy and healthy deliveries to everybody." And so again, our baby saves that we know about, we know there's more out there. Baby Eva, there she is at 6 months, rocking her Count the Kicks onesie. Nevaeh, that is, I'll show you, Deanna's daughter. She saved her daughter a couple years ago. And so, like Stephanie said, we couldn't do this without ambassadors. We could not do this without those boots on the ground, those wonderful women who are doing this in honor of the ones they lost or the ones they saved, or they're just passionate about it. And so we're so happy to share these with you. These stories are so important and powerful. They can really help in your childbirth ed classes. You can share these with patients. You can share these with expectant parents. They are on our website. Our stories are on our website. We have a YouTube channel that you can go to. What's that on here? I'll have to add that. But we have Facebook, Instagram, Twitter, website. Sign up for our newsletter so you will be the first to know when we release the app updates and the watch updates. And everything. So with that, I'm surprised we got it just under an hour, and so no more technical difficulties. And so I know you are all muted, but you can certainly use the chat box if you have a question. Again, like I stated earlier, this is recorded, so I will send out the recording along with some links like to the CE training. Go and order materials. This is one of my favorite things. I love to present, and then I love to see all my emails come in of people ordering materials. And so thank you to the Kansas Department of Health and Environment and Maternal and Child Health, because we couldn't do this without great partners like you all on the webinar today and with them. And so with that, I'll stop talking. If you have questions, feel free to ask them. Otherwise, I hope you all have a wonderful day.